So today, the Biden administration announced their investment of $3.2 billion from the American Rescue Plan as part of the COVID-19 antiviral development strategy. It's a whole of government effort aimed at developing the next generation of COVID-19 treatments, as well as preparing us for future threats. The program is called the Antiviral Program for Pandemics, and it aims to catalyze the development of new medicines to combat COVID-19, and importantly, to prepare for other pandemic threats. Of course, as we've heard so often now over the last several briefings, vaccines clearly remain the centerpiece of our arsenal against COVID-19. However, antivirals can and are an important complement to existing vaccines, especially for individuals with certain conditions that might put them at a greater risk. For those whom vaccines may not be as protective, we know that there are many people who are immunosuppressed, in which vaccines, at least initially, may not give an optimal response. And it also adds a line of defense against other unexpected emerging things like variants of concern that we are currently dealing with. In other words, it's going to accelerate the clinical testing of promising antiviral medicines that are already in various stages of development, including clinical trial. Things like the Pfizer protease inhibitor, the Atia Roche RNA polymerase inhibitor, the Merck mutagenic nucleoside, molnupiravir, and others that are in that pipeline. So it's to be accelerating things that are already in process. The other pillar is discovery. And this is very important because this is modeled after the highly successful program developed decades ago for the targeted development of antiretroviral drugs for HIV, which have led to transforming therapies to control HIV, namely discovering new antiviral medications.